Order. The next question, the member for Kingston and the Islands.
Speaker, we hear countless stories from the 2.5 million Ontarians this government has left without a family doctor. Two constituents in Kingston and the Islands who serve with the Canadian Forces were left with no family doctor when they finished their service. One is a teacher who was sent overseas for a 2-year posting, and when they returned, couldn't get re-rostered with their local clinic anymore. Another is a discharged CF member who has mental health complications, uses walk-in clinics, but struggles with having to explain their mental health history over and over again every time they see a new doctor. I ask this government, why is this okay? Would the minister make a way for people who have served with the military to have family doctors when they finish serving their country?
The Deputy Premier and Minister of Health.
Thank you. The member opposite raises an important issue, and I'm happy to take that away and see what we can do. But I also have to ask him that look in the mirror. Look at your party's history. You were a party that cut 50 medical seats, which now means that almost 350 physicians that could have been trained in the province of Ontario are not here. Do a compare and contrast. While you were cutting medical seats while you were in government, we have expanded. We've expanded medical seats in every single medical school in the province of Ontario, almost doubling them in Northern Ontario School of Medicine. We have now announced, and next September we will have a medical school in the city of Brampton. The contrast between what you did while your party was in government and what we have been able to do in 6 short years and will continue to do with now the announcement and ensuring that Dr. Philpott is leading primary care expansion in the province, that's getting...
Thank you. Supplementary question.
Speaker, this doesn't have to be so partisan. I once attended a dinner to recruit a New York family doctor at Kingston. What might they have heard? Well, OHIP billing hasn't paid for inflated costs. And then this government lowballed doctors during the latest fee negotiations, making an offer the arbitrator called, quote, completely unrealistic. What else did they hear? Well, the system makes doctors spend hours phoning around their networks, begging specialists to take their patients, handling the deluge of faxes on meds checks or minor ailments, or tracking down a missing fax the hospital sent to the MPP's home phone by mistake. This New York doctor might have been swayed by the 5,000 Ontario family doctors who walked away from family medicine. So why won't this government just fix the system and get more family doctors for the 2.5 million who don't have one?
Question.
Because they don't know how.
Stop the clock. I'm sure that's an interesting conversation underway between the member for Ottawa South and the Minister of Labour, Immigration, Training and Skills Development, but question period is still underway, and I'd ask them to wait until after question period's over, perhaps, to continue the conversation. Start the clock. Minister of Health to reply.
With the greatest of respect, the member opposite just admitted what hadn't been done on the previous Liberal government. Yes, we are absolutely dealing with this. We have been seized with it since Premier Ford came into office. Expansion of medical schools, expansion of seats, expansion to ensure that our residency students who want to practice in Ontario, who want to have a seat in Ontario, will now have that as a result of this afternoon's fall economic statement. We are absolutely getting this done, but frankly, if the two parties opposite had actually done their planning and their work, we would not be in this position, and we would not have to be rebuilding the way we've had to.
Thank you very much.